You've lost your period and you're more confused than ever. I get it. Sometimes it's PCOS and sometimes it's hypothalamic amenorrhea. You really don't know what's going on. And to boot, treating the wrong one can make everything worse. I'm Haley, I'm a certified coach. I've helped many women restore their hormones, get their period back, get them regular, and get strong without wrecking their hormones. And I've worked with women who thought they had PCOS, ended up having HA, or the reverse, and it's such a confusing place to be. You put all of your trust in your doctors, and they tell you the wrong thing. So in this video, I'm gonna walk you through 10 very important symptoms that differentiate the two so you have some knowledge going into your doctor's appointment. And of course, you can make an educated decision based on your body. So let's dive in. So PCOS is a hormonal dysfunction, particularly with insulin and male hormones known as androgens. This means that your body is producing too much insulin and too much androgens, aka male hormones like testosterone. HA, on the other hand, is functional suppression of your reproductive system. Your body perceives the stress of undereating, the stress of overexercise, and just perceived stress of your life as a threat, and it puts a pause on your reproduction. So in other words, it's more of an energy conservation response. So to summarize all of that, PCOS is hormonal dysfunction internally, whereas HA is energy deficiency. Number 2 is LH and FSH hormonal ratios. So in PCOS, luteinizing hormone, known as LH, is elevated compared to FSH, or follicle stimulating hormone. And that ratio usually ranges from like 2-to-1 or 3-to-1, depending on the woman. It causes an imbalance and disruption in ovulation. However, in HA, both LH and FSH are going to be low because, again, it's a suppression of your reproductive system. Your hypothalamus is not sending enough hormonal signals to initiate your menstrual cycle. And to this, I say blood work freaking matters. Get your doctor, even if they tell you that you're crazy and you don't need blood work, to get some blood work done, because having this information is going to be very pivotal in you knowing whether it's going to be PCOS or whether it's going to be HA. Number 3, body weight. Stay with me. And history of body weight. PCOS can happen at any weight, but most of the time, women with PCOS struggle with abdominal weight gain and struggles with losing fat due to insulin resistance. And HA tends to show up in women who are underweight or have lost weight very quickly, especially if they're athletes or you consider yourself a very active athletic woman. However, weight is not a diagnostic and it can happen to anyone at any weight. I've had many clients, myself included, have HA at a normal BMI. It was actually like 22, my BMI was, when I lost my period for the second time. And I see that across the board with so many of my clients as well. And that is because you may not be at a healthy weight for your particular body. Fun fact, side tangent, BMI is a very ancient sort of way to gauge your health, and it was created by a mathematician, not a physician. And a much better indicator of health is body fat percentage. Are you at a healthy body fat percentage? Your frame size, calculating your frame size, like what is a healthy weight for that frame. So if you have a smaller frame, then obviously a range is going to be lower than if you have a larger frame. Okay, so those are some things to take into consideration if you are complaining that you lost your period and you're a normal weight, okay? Number 4, androgen-like symptoms. So with PCOS, again, you have those high androgen levels, and some very common symptoms that you may see are male pattern balding. So thinness of hair, however, it can also happen in HA. I'll get to that in a second. Hormonal acne, specifically like cystic acne along your jawline. And excess hair in very odd patterns, so like your face, your stomach, your chest, your back. And in HA, your testosterone will likely be on the lower side, so you won't have as exacerbated symptoms of these. However, I do want to point out, if you have HA, you're likely going to lose your hair in clumps, and that is because, again, energy deficiency deficiency, your body does not have the nutrients it needs to hold on, build hair, grow nails, allocate to skin health. So you might have acne. You're gonna be cold all the time, so your body might produce a little bit more hair on your body in general, just to regulate its temperature, because you're not doing it itself. Number 5, ultrasound and ovarian appearance. So this can be a tricky one because women with HA and women with PCOS both have cysts on their ovaries to some extent. In PCOS, it's more of like a string of pearls per se, because there's multiple immature follicles that have not ovulated. In HA, your ovaries are more quiet, so the follicles are not developing properly because there is no surge in LH hormone. So there will be fewer and smaller follicles, however, they will be present, so an ultrasound may appear similar. But keep in mind, 1 in 4 healthy women have polycystic looking ovaries, but that does not confirm that you have PCOS. Number 6, insulin and blood sugar regulation. Insulin resistance is very common in PCOS, and it may cause crashes, fatigue, cravings, inability to lose fat, again, specifically around the midsection. And you may also see elevated fasting insulin and elevated glucose levels. With HA, either your blood sugar is going to be more stable or it's going to be on the low side. Oftentimes HA, it comes along with clean eating, low carb, under eating, so your insulin levels are going to be lower. And this might cause you to feel lightheaded, have the jitters, or get dizzy, all of which I have experienced in my HA days, and it's definitely not very fun. Number 7 is going to be exercise and training history. Women with PCOS often really benefit from strength training, blood sugar regulation benefits of having more muscle mass, which also helps with lowering androgen levels and improves insulin sensitivity. And HA, it's commonly caused by too much exercise or an obsession of exercise. Typically like high intensity workouts, endurance training for a marathon. If you feel like you need to sweat profusely at every workout, that might be an issue. And especially fasted cardio, your body perceives that as a major stress and shuts down ovulation. So if your symptoms have become present after a ramp up in your workouts, diet that you recently went on, or training for a marathon, it's very likely that you are experiencing signs of HA or progressing towards HA. Number 8, eating behaviors and relationship with food. PCOS is not essentially tied to any kind of disordered eating. However, a lot of women do experience carb cravings just because of the swings in blood sugar balance and insulin levels. So some people may experience some more like binge tendencies. However, like full-blown EDs are not usually tied to PCOS. HA, however, is very heavily tied to clean eating, having fear foods, under eating, and orthorexic tendencies. And for those who don't know what that means, it means just an obsession with eating clean and scared of eating anything off plan, like a burger or a cookie or what others may perceive as bad food or junk food. And those are really common denominators for energy deficiency. And number 9, leptin and ghrelin levels. So leptin is your fullness hormone. It lets your brain know that you're done eating, I'm full, I'm satisfied. And ghrelin is the opposite of that. It kind of pangs hunger, it makes you think about food, and it urges you to eat. Leptin is usually high in women with PCOS just because of the added fat mass. Fat mass does produce leptin, which makes you feel full and not hungry. In HA, leptin levels usually are lower just because of a low body fat percentage, low energy intake, and this signals to your brain, hey, this is not a good time to reproduce. I can't even sustain my own life. How do you think I'm going to sustain another life with a potential pregnancy? And this is also where I see women struggle with like mental hunger, and when you do decide to recover, that insatiable hunger starts to come in. And this is a very normal thing. I feel like, especially myself going through period recovery, it was a bit of a mind F because I was like, I needed to stop eating and I can't control myself. But genuinely, this biologically makes sense that your body is insatiable at the moment. And when you get to a point where your body fat percentage is in a good, healthy range, this constant hunger will go away. So how do we recover from both of these conditions? PCOS is often improved by carb moderation, strength training, stress reduction, gut health focus, and managing insulin through lifestyle and meal timing. HA requires eating more, exercising less or with lower volume, stress management, and likely gaining some healthy weight. So if you have HA and try and treat it like PCOS, you could likely be digging your grave even deeper, right? And I see a lot of women who have HA and do struggle with disordered eating thoughts, and they want it so badly to be PCOS because that means they continue to diet. But please don't be your worst enemy. If you think and your gut is telling you that it is HA right now, like you've just watched this whole video and you're like, I think I have HA and I just really need to get on my shit, then take this as a sign to start to recover because you so deserve to recover. Anyways, how do you know which one you have? Get your labs done. LH, FSH, estradiol, testosterone, DHEAS, fasting insulin, glucose, and leptin. Those are the tests you need to ask for. Don't let your doctor think that you're crazy. To evaluate your lifestyle, are you under eating? Are you over exercising? Are you under a lot of stress? Is your nervous system regulated? Get some help. Go see your OBGYN, a GP. Go see someone who takes you seriously. Or if you struggle with the whole process and want more of a one-on-one approach, my coaching application is always in the description. I'm more than happy to see if I can help you. And with that being said, I hope you found this video helpful. Make sure you save it for the next time you go to the doctor. Like, subscribe, drop your comments. Tell me what kind of experiences you have with PCOS, with HA, with doctors. Give me the lowdown, give me your stories. I would love to hear them. And in the meantime, I will see you guys in the next one.